Hello, everyone. Thank you again for joining our webinar. I see we have over 40 attendees from public housing authorities, continuums of care, and service providers from around the country and around the world. So thank you all very much for your interest in this, and we look forward to your questions and to partnering with you. My name is Rohit Mainpalli, and I work on the research and policy teams at JPAL North America. With us on the panel today and people you'll be hearing from are Sarah Argodale, who's an evaluator in the King County Department of Community and Human Services, Kim Dodds, who's the Prevention and Diversion Program Manager at the King County Department of Community and Human Services, Christina McHugh, who's Lead Evaluator of Housing and Homelessness in King County's Department of Community and Human Services, and finally, David Phillips, who's the Associate Research Professor of Economics in the Wilson Sheehan Lab for Economic Opportunities at the University of Notre Dame. Voices you won't hear from, but who played a critical role in putting this together and really moving our work on homelessness and housing stability forward are my colleagues Jacob Binder and Ariel Rawlings, who also work with me at JPAL North America and lead our work on homelessness and housing stability. And a big thanks is owed to them for organizing this. And they're also going to be collecting your questions and answers and coordinating the entire event. Could we move to the next slide, please? So this is just a quick overview of what we'll be covering over the next hour or so. I'll give you a short introduction to JPAL and randomized evaluations. Then we'll hear from David and the team in King County Department of Community and Human Services about an ongoing evaluation in King County under the Youth and Family Homelessness Prevention Initiative. And then finally, we'll go over some of the logistics of the Housing Stability Evaluation Incubator in case you're interested in applying. And then hopefully we should have plenty of time for question and answers at the end. One request when we get to the Q&A section is please type your answers in the box on the bottom right of your screen and make sure that it's addressed to all panelists, and we'll try to get to everyone's questions. So with that, let's get into it. Could we move to the next slide, please? So JPAL North America is part of the JPAL as a whole. JPAL stands for the Abdul Latif Jameel Poverty Action Lab. And we're a research organization based out of the Department of Economics at the Massachusetts Institute of Technology in Cambridge, Massachusetts. And our mission is broadly to reduce poverty by ensuring that policy is informed by scientific evidence. And our staff do this through a number of different activities. So there's the actual research work with the evaluations where we evaluate social programs to get a measure of impact and determine what's working, what isn't working, and the degree to which programs are having an impact. And an example of one such evaluation will come in a little bit when we hear from the team in King County. Then we have our policy team, which does policy outreach to ensure that the results of these evaluations actually make it into the hands of implementers and policymakers, but also to build up partnerships between researchers and policymakers so that we can get more evidence-informed policy going. And finally, we have our capacity building team, which is capacity building activities with researchers and policymakers to help ensure that everyone becomes not just better commissioners of evidence, but also better consumers of evidence. In addition, JPAL is a network of affiliated researchers in a number of disciplines from economics to public health. We have over 150 professors in our network in universities around the world, some of which you see on your screen. And those universities include the University of Notre Dame, where David Phillips, whom you'll hear from in a little bit, is based. We conduct our evaluations in a number of countries around the world. We're almost at 1,000 ongoing and completed evaluations in over 80 countries. You'll also see a number of JPAL offices marked there. So each region, broadly speaking, has one JPAL office that's dedicated to doing research, policy, and capacity building work there. Jacob, Ariel, and I are based at the JPAL North America office, which is based at MIT and that focuses on research in the North America region. This is an overview of our current projects related to homelessness. We're still in the very nascent stages of this work, and part of the reason we're very excited for this incubator is to get more projects going. So you can get more information on this if you go to povertyactionlab.org/homelessness. We have projects ranging from an evaluation of rapid rehousing in Santa Clara County that David Phillips is involved with, to one on diversion to prevent evictions in Miami, Florida. And then, of course, you have the homelessness prevention program that's being evaluated in King County, Washington, that we'll be hearing from next. So I'd like to talk very briefly about the element that unites all of JPAL's evaluations, and that's the use of randomized evaluations, or RCTs, randomized controlled trials. Methods broadly, your method of evaluation, broadly speaking, can be viewed as a tool. You might use a different tool based on the question you have at hand, or depending on the context of the various constraints that your program is facing. And at JPAL, we believe that when possible, a randomized evaluation can be an especially rigorous way of gauging the impact of a program. So how does a randomized evaluation work? You start with your program with eligible individuals, and then you randomly assign them to two groups. By randomly assigning them, you can guarantee that with a large enough number of people, the two groups are statistically similar. And so once you have one group receiving the program or the treatment, and one group not receiving the program, also known as your control or your comparison group, any difference in outcomes after the program can be attributed to the program and not to any pre-existing differences between the two groups. So as a result, this process of randomization gives us two comparable groups that we can then use to truly rigorously gauge the impact of the program. That having been said, as we said, a randomized evaluation may not always be what's applicable in your context. And part of the goal of the incubator is to have our staff work with you to determine whether a randomized evaluation is a good fit for your context. A couple of situations when a randomized evaluation might be especially useful is if you're running a pilot program and you need to have an evaluation to inform decisions about whether or not to scale up or continue the program. Or say you have a program that's oversubscribed and you can't serve everybody. Random assignment may be a fair way to both allocate spots in the program and also to then get a handle on what the impact of the program is. Similarly, if you're expanding the program to a new area or population, you could consider using random assignment to decide whether or not, or to decide how people receive the program. There are also a couple of other considerations that might all determine whether or not a randomized evaluation is a good fit for your program. Our staff are here to help you suss out this feasibility. And as I'll talk about at the end of the webinar, we're happy to talk with you to determine whether you want to apply to the incubator or not. So next slide, please. And so with that, I'll pass it over to David and the team in King County, Christina, Sarah, and Kim, who will talk to you about the evaluation that they're working on in King County, Washington.
Next slide, please. Good afternoon. This is Kim Dodds. I am here with my colleagues Sarah and Christina from King County, and we're excited to participate in this today and share with you what we have experienced doing a randomized control trial for a very difficult population in King County. We have been doing a randomized control trial to test a pilot program in homelessness prevention for youth and families with youth. And this was a good fit for us, both because it was a pilot and also because there would be oversubscription of needs for services within our community. We developed our program first, as was said. So we had a program that was going to be an innovative homelessness prevention program that would couple intensive case management with flexible financial assistance. When we established the parameters for the randomized control trial, when we were considering the fact, when we were developing the program, that we would participate in some sort of an extensive evaluation or randomized control trial, we had to develop the program in a manner that afforded that down the road. So while we didn't know we were going to do a randomized control trial, we had thought of that in the beginning because this was a pilot, and we wanted to make sure that what we were doing and how we were doing it was really working and effective. So one of the things that we set up front was that we required that households agree to participate in data collection. That alone created some complications for us in developing the program, and we had to develop our own database in order to hold that data. It required that all case managers through contracts tracked all client-level services in the database. This, too, is unique for case managers and required a lot of training and a lot of support to the case managers. One of the other criteria that we set in advance was that households could not have been in the homeless system within the last 90 days. For this reason, we wanted to ensure that our program was truly preventing homelessness and was not a program that would be running consistently within the homeless system. There had to have been a gap in services, a minimum of 90 days. And then one of the really unique things about this program is that we funded 25 case managers that would represent the diversity that we have within King County. That diversity was not only within the case managers themselves and representative of the communities they served, but it ensured that we covered services throughout all of King County, which is a very vast county within the state of Washington. One thing that was important to us was there was a lot of discourse around prevention from the very beginning, a lot of philosophies that you can't actually prove, who will become homeless, so how can you prove overall effectiveness. This is essentially why we had built into the program and why in our implementation plan under Best Starts for Kids, there was the requirement that we do an external evaluation so we could once and for all add new dialogue to the conversation that says, actually there is a possibility and probability of preventing homelessness for the right families, but that targeting is the key. So within our program, we work to dispel that discourse by saying, it is important that we learn more about the households that we serve than develop a program that we think is theoretically going to help people. So we knew that we had this wide body of people. We had 25 case managers that were working with the populations, working with the communities, building relationships that could do a lot of the work for us, and that they would be in the position to best identify where somebody's risk might be. So early on, we created all kinds of training tools. This is one of them that you see, where we would ask case managers, where is the household at on the cliff? So down on the sand, households were stable, kind of climbing up the cliff a little bit, you would see that they were unstable, that a lot of households and a lot of people we ended up working with were at risk, and that we were going to strategically serve those at imminent risk of homelessness. So the whole plan for this, the whole targeted population for us was those at imminent risk of housing loss, which means without our assistance, they would in fact fall off the cliff and become homeless. So the first implementation of this was really working with case managers to try and test and figure out where is that tension point between households who are at risk of homelessness and those who are at imminent risk of homelessness. We then developed a tool in order to run our randomized control trial that we called the Standardized Risk Assessment Tool that would then couple vulnerabilities, historical vulnerabilities for households that do become homeless with this key observation piece that our case managers were doing. So we had two stages. We would have this pre-assessment where households were determined for where they were at on the cliff, and then we actually implemented a standardized risk assessment tool. So with those two things in combination, we were able to identify vulnerabilities and actually place people in a position to determine where their risk factors were, and that allowed us to engage in a conversation with case managers that we'll talk about in just a moment about some of the concerns they had about when you participate in a randomized control trial and you're saying some may receive the services and some might not be able to receive the services. How can we balance the tension between what case managers felt were, I've identified this household to be at imminent risk, where the risk assessment tool identified the household to be at risk, and yet where we were going to increase some additional vulnerability by saying, and yet you may not receive these services. Next slide. So for us, the randomized control trial was going to take the population that we worked with, knowing that we had used our best resources, our case managers, to identify who was at that imminent risk of homelessness, and then the intervention that we had developed, which was a program of intensive case management that would couple flexible financial support, would then be changed through the randomized control trial to allow one of two different interventions. So even though every household would be qualified for the full intervention, which was case management and rental assistance, the portion of the group that was randomized would then be given the rental assistance only. So the control group would be those that would receive rental assistance only. At the onset, we weighed some pros and cons of participating in a randomized control trial. One, we didn't want to do this in a vacuum. When we knew that we had aligned our implementation plan with doing an evaluation, we certainly didn't want to force something amongst 25 case managers that would be doing the really hard work and actually implementing the randomized control trial without getting their feedback. So we definitely brought the case managers in up front and had those conversations with them. I think that was really important for that. We also need to understand our own team structure, and did we have the structure in place in order to really do a very strong randomized control trial. Again, that data is really key to this. Did we have the data available, the database structure, and did we have the team in place that we could actually support a randomized control trial? When you just tease a little bit of that out yourself, one, do we have a data team? Yes, in King County, we have an amazing data team that is able to actually take a look at the two different control groups, or the two different groups. One, those who entered into our system who had never experienced homelessness before, and then look at our homelessness system and compare the two groups to say, and then did they show up homeless? So you have to have, one, the ability to collect the data, two, a team internally that can take a look at that data and support the work. We also have concerns about training case managers in how to do data and how to do data well, and to make sure that the data that they were putting into the database was accurate and timely. That required that we have a very strong staff here in our own staffing that could work with the case managers, do training with the case managers, pull our own reports continuously in order to see, is the data that is going in from the case managers good? I'll give you a quick example for that. When they're randomized, they are put into group A or B for us, and going through as staff and ensuring that the household that was put in A, that the case manager also identified them as being an A. There's just these nuances that you have to ensure when you're thinking about doing a randomized control trial that you've considered up front. And then we also had to think, is this going to be worth it? Is the randomized control trial going to prove effectively for us that, one, we can prevent homelessness, and are we doing it? Are we doing this program in the right ways? So there were a lot of considerations that we were looking at when we talked about the pros and cons, especially of a randomized control trial, which is a more rigorous standard of evaluation. Next slide. And I'm going to reiterate that randomized control trials can be a heavy lift for organizations. So you need to make sure that you have the infrastructure to be successful. So we have a team of 3. We have one staff that's completely dedicated here to going out and training the case managers, would go out on site and do observations of the case managers as they're actually implementing the randomized control trial with the household. We have another staff person here that digs into the data and makes sure that the data is accurate. We have another staff person here that's putting together training modules for the case managers. We also do monthly learning circles that allow us to work. There are 2 sessions, one in the morning, one in the afternoon. The one in the morning is all basically data-driven, where we have staff on site able to provide technical assistance. These are things that you really need to think about. And then the heavy lift for the organizations is there was a moral imperative here that often bothered the case managers. A lot of case managers, when they were told that the randomization would begin, were very concerned about what does this mean for our most vulnerable households. Again, we brought in our case managers, our executive directors in advance to address some of these questions and to dispel some of those moral kind of concerns that they had. Not necessarily dispel, but ask them, how can we do both? How can we create a randomized control trial and yet help to combat some of the concerns that you have? We were able to do that. I think you have to think outside of the box sometimes, but for us, our case manager said, we believe at this point, which for us was a point evaluation or point score on that on the tool, that at this point, households are just too vulnerable to participate in this study. So we were able to take households that scored above a certain threshold out of the study altogether. That was being respectful and responsive to the case managers and executive directors, and gave them a little bit more buy-in to, yeah, we think we can do this. We also had to create a structure that ensures that case managers had time for data. A lot of times case managers don't feel well supported to put in their data, so data often is the last thing that they're interested in doing. We built this in as a contractual policy where we gave them 40% of their time to do data. It's really important. You have to consider that. You have to support that as well. Also, when you're thinking about, their concerns and their fears, it's not a one-time concern and it's not a one-time fear. Staff has been available and accessible, which is really kind of unusual from a contract management standpoint, to help guide and work with case managers all of the time. So our staff would tell you that we spend 30 to 40% of our time actually on the phone working with case managers helping them to work through some of their concerns and fears when they're working with different households under the randomized control trial. You also need to be prepared that staff turnover is going to happen, and it takes a lot of work and a lot of effort to train up your staff into how to properly implement a randomized control trial. So you need to be prepared for that within your own staffing too, so that you can make sure that the randomized control trial isn't adversely impacted. And then you want to make sure that you never lose sight of the focus either, that you're continually reminding yourself the why. Why are we doing this? For us, we want to end that conversation of prevention doesn't work. We absolutely, with the work that we've been doing here in King County, believe wholeheartedly that prevention works and that we need to redirect some of our strategies here and some of our financial resources more towards prevention. And we're very happy to have participated in the randomized control trial that is actually giving us the data that is actually supporting the evidence to say, yeah, you can prevent homelessness. So for us, this has just been a wonderful experience and opportunity. It's had some hard points that you've heard me talk about, but we are very supportive of randomized control trials and actually considering one for another new program we're in the process of developing. So I'll be available until our data team. They are both here, and they're brilliant at data to answer any questions you have, but I believe, David, it's your turn.
Thanks so much, Kim. So my name is David Phillips. As I was introduced earlier, I'm a research professor at the Wilson Sheehan Lab for Economic Opportunities, or LEO, at the University of Notre Dame, and glad to be partners with the folks at King County on this particular project and with our friends at JPAL on multiple different projects. And so as Kim said, right, this is a project that's about measuring the impact of homelessness prevention. If I were to try to put it all into one question, it's the question you see on your screen. That's the question that we're trying to answer with this study. So among households at risk of homelessness, how much does adding individualized assistance from a case manager improve housing stability relative to financial assistance alone? We can go to the next slide. And so the way that we're doing that, as was mentioned before, we're operating an impact evaluation that's trying to measure a difference in outcomes between two different groups. And those two groups are set up to make this comparison between maybe a more traditional sort of financial assistance focused homelessness prevention program and one that has a sort of broader, more comprehensive set of services, including a lot of case management. So the first group is sort of the standard youth and family homelessness prevention initiative in King County as it was designed, which involves a significant amount of financial assistance, right? Think about this, if you want to think about this as a month or two of rent in your mind, that's going to be roughly the right ballpark. And then also there was a progressive case management. So it could be progressive, meaning that it could sort of be different lengths for different groups of people, right? Some people are going to want sort of intensive help with just resolving things with their landlords up front. Others are going to want several months of interacting with this case manager. It could look different for different people depending on their situation. The activities could be different depending on what is going to reduce homelessness for that particular person. But that's the basic idea, right? Is instead of just getting cash, you get cash and a person who's going to help tailor this service to you and helping you try to achieve housing stability. And so we're comparing that program, as was sort of designed ambitiously by King County, to something that might be more familiar, which is sort of a one-off financial assistance. It's very rule-based. Someone needs to verify that it's needed, that here's the landlord you're going to pay it to, and all of this sort of thing, but that the staff's involvement is basically limited to the activities required to get to cutting that check to be able to meet the financial need immediately. And so then the question is, if we have a situation where people are being assigned to these two different types of services, how much benefit do we get from this additional staff time of case management from that individual touch? That's the question we're trying to measure the answer to with this study. And so an important component of some of the elements that were important for setting up the study and what Kim talked about before is the eligibility process. So Kim mentioned this risk tool that the county was going to be using for the program anyway, even in the absence of an evaluation, but it's used to try to identify people who are at high or lower risk of becoming homeless out of a group of people who are currently housed and are seeking services. In the absence of the evaluation, you probably have two groups, right? You'd have this scoring scale. At some point, you would draw a cutoff and say, if you're below that line, sorry, you're not going to get assistance. If you're above that line, you're higher risk, then you would get the assistance. What the evaluation did is it created a third group, a middle group, that would go into a lottery into a random drawing where some people would get this case management and flexible funds, and others would get just financial assistance immediately in sort of a rule-based way. And Kim sort of referenced this before. We carved out this middle group in which to do the evaluation, and we actually didn't include the people at highest risk of homelessness. And that's not because it wouldn't be interesting academically or from a policy point of view to know, to be able to measure impact for that group, but it was from a sort of ethics point of view and from having this conversation with our partners, both at the county and in the nonprofit organizations that are operating the program, that it just, we couldn't do that in a responsible way, and so we carved out that group so that they go straight to case management. And so that was one important piece of the design. We can go to the next slide, which sort of gives so the risk screen is an important part of the process, but it's part of a bigger process. I'll highlight a couple pieces of. So people come in at the beginning and they go through this risk assessment, and that determines eligibility, right? High risk are not in the study, but they are in the program. Low risk are not in the program or the study and are referred to other services. This middle risk group are the folks who are invited to participate in this study. There is a second step that was also important. So the other piece of sort of addressing the ethical concerns about doing random assignment in the context of homelessness prevention was an informed consent process. So people were informed about this opportunity. You could join this study. It would give researchers access to some additional information about you. It would also mean that you would be in this drawing, to have a drawing between straight financial assistance versus this more comprehensive program. And people could either consent to participate in that or not. And there are a good number of people who don't. And part of the goal there was actually to identify people who they sign up for the study precisely because they think that what they need is the funds. Sort of some of the premise of the program in the first place is that there is a group of people who come into the situation believing what I need is financial assistance that actually could benefit from this additional case management. And so in some sense, that's what we're testing. For a group of people who've opted into this thing, here's the difference in outcomes between the two groups. So we end up in the end with a group of people in the study who are at moderate risk of homelessness and who have consented to participate in this random drawing. And then among those group of people, we end up, a computer draws a random number, and that decides whether the person goes into just financial assistance or gets financial assistance plus case management. We can go to the next slide. Thank you. And so then after the fact, what we're in the process of doing now, enrollment is almost done now, and then we link up both of those groups to different outcomes. Most immediately, data that many people on the phone are probably familiar with, like Homelessness Management Information System, HMIS data on entry into homelessness services like emergency shelter. We have some consumer reference-based data on address stability and whether people move, which is important for homelessness prevention, seeing whether people are able to stay at their existing address. And then we have a host of other downstream outcomes that, provided we see benefits in terms of increasing housing stability, other things that might affect about people. The state of Washington has nice administrative data that we receive people's permission to link to their records on things, for instance, like employment and earnings, or their children's contact with the child protection system and things like that. Where we are in terms of this study, this is a longer term study. Studies vary and randomized controlled trials vary in how long they take. This one is on the longer end of the timeline. We started planning this about 3 years ago in summer of 2017. In summer of 2018 was an enrollment in the study started, and we've enrolled people in the study for about the past year and a half. Enrollment is just about done. It'll be wrapping up here in the next couple of weeks. So we will pretty soon be able to, in the next few months, be able to have our first big milestone of learning, which is being able to link to some of those immediate outcomes on housing stability to know what's happening to people in these two different groups and compare them. And then as time passes, we'll be able to see what happens with people's lives down the road as we wait to see what differences show up in the lives of the people in these two different groups. So a couple things to reflect on before I conclude. Things that we've learned along the way. I think one is, and Kim touched on this a lot, so I won't double up on it too much, but I do think thinking about ethics in the context of people who are in emergency situations, who are at risk of losing their housing, right? There's a lot of work that has to go into responsibly building research in, especially randomized controlled trial with a random drawing around that type of situation. And so I think, as Ken mentioned, right, the study design was very much a process. What we started with on day one was different than what we ended up at the end. And there are pieces of that research design, particularly carving out people at high risk, that were really important for doing this responsibly and having everyone believe, yeah, this is a thing worth doing. And that we're going to learn the answer to the right question, and we're also going to be treating people with respect. So I think the ability to listen and stay in conversation is really important for these sort of, for running RCTs in these sort of hard to evaluate areas. Another thing that we've learned a lot about from this project is coordination. There's 24 different agencies that actually operate the program, and so creating a common process and training. So Kim has invested a lot in that process that she sort of alluded to, of doing more than just sort of standard contract management, but really building a common culture and process and training among this group of people was fundamental to being able to have everyone actually do the intake process and such that was mentioned before. And a final one that I'd point out is that this is a fairly complicated intervention, right? We're trying to measure the impact of case management, and sometimes things in housing homelessness space are like this, right? You have interventions that are kind of complex, and at the end of the day, what does a randomized evaluation tell you? It tells you what's the difference between group A and group B. In our context, it was important to build in around that some additional qualitative elements so that we could learn about what the difference between those two groups means, why there are differences between those groups. And so we have some great partners, both in terms of the staff who run the program, folks in the county like him, to learn more about the context, and actually an explicit qualitative research component where some of our friends from the University of Washington were able to do some more direct observation and in-depth interviews with some of the staff to better understand how this thing actually works to get inside the black box. So we've learned, I think, along the way a good bit on these 3 different points from what has been, I think, a pretty ambitious and complicated, but fruitful and rewarding collaboration.
Great, thank you all so much. And so with that, we'll go into some of the details around the Housing Stability Evaluation Incubator. Hopefully hearing from David, Kim, Sarah, and Christina has gotten you excited about getting your own randomized evaluation going. And so now we'll go through the process of how that could possibly happen. So what would you get applying to our Housing Stability Evaluation Incubator? Well, a few different things. So first, if you're an implementing organization or a policymaker who has a program that you'd like to evaluate, but don't really have an evaluator or researcher, that's something our staff can help with. So we can match you with researchers like David in our network who are interested in working on these programs. Similarly, we provide technical assistance so that at this initial stage where you're looking to suss out whether your program is right for randomized evaluation, what might be some of the key questions that need to be asked? How do you get buy-in from the various stakeholders involved? If there are specific considerations you would like to have incorporated into this, and then that kind of process of designing an evaluation collaboratively. David talked about the critical role that people on the ground play. All of this, that's all wrapped up in this technical assistance component where our staff will work through this incubator with you. And then finally, there's flexible project development funding of up to $50,000, which can go towards some of these initial costs towards setting up an evaluation as you get through the research design phase. And so matchmaking, technical support, and evaluation funding, these are broadly the 3 components that we get. And our incubator is now open. So JPAL is now inviting letters of interest. So if you are interested, please submit a letter of interest, ideally no longer than 3 pages, describing the policy challenge that motivates your application. So it could be, we have rising rates of homelessness, of people experiencing homelessness at disproportionate rates in certain populations, and we would like to address this. A brief description of the proposed programs or policies that you want to use to address this policy challenge, and any other information that you think would be helpful for JPAL North America as we assess which programs or policies are most suitable for the incubator and for randomized evaluation. We have pretty detailed application instructions and guidance that can be found online at the link there. We'll also be circulating this online, and if you go to povertyactionlab.org/homelessness, you can find these detailed instructions. In terms of scope and eligibility, really, if you're an organization in North America that's interested in using randomized evaluations to answer policy-relevant research questions and strategies to either reduce or prevent homelessness, we really invite you to apply. If you're on the fence, we urge you to err on the side of applying versus not. And generally, any proposal that's exploring either forward-looking mechanisms to prevent homelessness, such as the one that we talked about earlier with the Youth and Family Homelessness Prevention Initiative, or interventions and services for people experiencing homelessness. Both of these are potentially in scope. If you would like a comprehensive review of the types of questions that we're considering as part of this incubator for reducing and preventing homelessness, please see JPAL's evidence review, Reducing and Preventing Homelessness, Lessons from Randomized Evaluations. Again, I would just like to reiterate that our staff are here to help. both through the incubator, but also one step further. If you have questions around whether you should apply, what should go into making a stronger application, we urge you to reach out to us, and we will be happy to schedule a 30-minute phone conversation with you where we can address some of your questions or brainstorm ideas. There's a team over here that consists of Jacob, Ariel, and me, and one, if not all of us, would be more than happy to talk with you. Finally, in terms of the timeline, as I mentioned, we're accepting letters of interest right now. The deadline to submit those letters is April 6th, so there's still a little bit of time. By May 4th, we hope to select finalists and invite these finalists to submit full proposals for funding. As part of that timeline between May 4th and July 20th, which is the deadline for submitting full proposals, our staff will work with those finalists to ensure that the strongest proposal is submitted to our review board. And during that period, finalists will also be invited to attend our Evaluating Social Programs course in Cambridge, Massachusetts, which will take place in June. This is a 5-day course where participants are guided through the basics of evaluation and randomized evaluation so that you can then take these lessons and apply them in your own context. And finally, the week of September 14, 2020, our review board will make an announcement about which finalists have been selected to partner with us through this incubator. And then for the period of up to a year, we'll provide the services that I mentioned, matchmaking, technical assistance, and evaluation funding. And the goal is that by September 2021, we could have a full proposal that can then lead to an evaluation that either can apply for full funding through JPAL or another source. And so with that, we have roughly 20 minutes for question and answers. So please submit them in the box at the bottom, as we said, and direct them towards all panelists. Some questions have already started coming in, and so I'll just take them one by one or punt them to the other panelists.
Great. Well, for the next question, I think we'll ask the King County folks. So the question is, how much time did you give you and your teams to plan and set up the process before starting the RCT? What was that time frame that you had planned for, or did it change over time?
So I think this is David, and the King County folks can jump in too. I mean, for this particular project, I think the initial setup time, was about a year to plan before we started enrolling people in the RCT. That was about what we expected because we were sort of building this new enrollment process and trying to figure out how exactly to make it work correctly. The process of actually enrolling people instead took a little bit longer than we initially expected. I think we initially planned for about a year, and it ended up taking more like a year and a half because enrollment was a little bit slower. But that was probably the one main difference between the initial timeline and the final timeline.
I would agree with that.
Great. So the next question we'll talk about is kind of going into the purpose of the funding that's available through the Evaluation Incubator. So the funding is relatively flexible, so it kind of depends on the needs of your organization and what exactly is required. But yes, it is primarily to get an organization up to the point of being prepared for submitting a full RFP. If that can take many different forms. So in some cases, it's more of an exploratory design process. In some cases, it involves site visits, so someone from the JPAL North America team or multiple people, in some cases researchers as well, will find time to go visit the organization and really understand the program from an on-the-ground perspective and what might be needed to prepare for a full evaluation. So the funding, as I said, is flexible, but the purpose is to get organizations up to the point that they're prepared to run an evaluation.
So the next question we have was, would it be okay to involve local researchers at either local universities and or other organizations, or do you prefer to work only with JPAL staff? So JPAL is primarily an academic institution. The goal of the studies we support at JPAL is ultimately the results will end up in some type of academic publication or paper as a means of building evidence that is both policy relevant and relevant to the questions of many of our academic researchers. As far as involvement with local researchers, so many of our projects involve local researchers. The one condition is that for applying for full funding, so for full funding to cover the evaluation in terms of data collection and implementation, JPAL requires that at least one JPAL affiliated researcher or invited researcher be on the research team to receive funding. So that's the one requirement for involvement of JPAL affiliated researchers versus researchers from other organizations.
Great. So the next question, we will also ask the King County folks to chime in if they're able. So the question is on the person who was kind of dedicated, or the staff members who were dedicated to data entry. You had mentioned that about 40% of each FTE was dedicated to data entry. And so the question is, did the funding for the RFP fully cover that differential, or were there other kind of inherent costs that you had to take on as an organization that weren't covered by the RFP funding?
Great question. So I'm going to imagine that has two questions linked into it. One, there's the 40% was directly connected to the case manager's time. So oftentimes case manager's time isn't prescripted so well, and data entry isn't that cumbersome, but in this program it was. So we provided funding, equal funding across the board to all of the 25 case managers in the program, and then said for 100% of your time, you could spend 60% of your time working directly with households, and 40% of the time should be directed to do your data entry and or training, of course, at our monthly learning circles, and any form of technical assistance you would need. As far as our staff time, I think that was an unanticipated kind of interesting phenomenon with the randomized control trial. Was not, so when I was hired to be a program manager for this program, I knew that there would be elements based on having our own database, requiring me to have a certain amount of time in the database. But I would definitely say ensuring that data quality was high for a randomized control trial. I have equated about 30% of my own time directed to data. Since this all began, I did not anticipate that would be the amount of time I would spend doing data as a contract manager program developer for King County. So I think you do need to take those things into consideration, and then we have had dedicated staff, and we've had to set aside additional funding to support our data team here that does so much of the data, pulling the data to submit to Notre Dame every week, and in order to do the evaluation for us to see who enters into the homeless system. So there have been considerations there we needed to factor in, as well as additional budgetary concerns. So there's both the time and the factors of who's involved in this, and so I think you have to think all of that through.
Great. So our next question is, have public housing authorities been part of past JPAL-funded research studies? The answer to that is yes. So we have a few ongoing evaluations with public housing authorities in the United States. The one that comes to mind initially is the Creating Moves to Opportunity demonstration project, which is an ongoing randomized evaluation partnership with the King County Housing Authority and Seattle Housing Authority in the Seattle area in Washington, evaluating a comprehensive housing mobility program. So not directly related to homelessness, but certainly several of the families that are part of the evaluation are coming into the voucher program from being unhoused. We also, in terms of direct funding, so I should clarify, that's a project with several JPAL-affiliated researchers, and JPAL staff have also helped support that evaluation. We at JPAL have not funded that evaluation. We've, however, partnered with the Minneapolis Public Housing Authority on a pilot project also related to housing mobility, and through that we were able to provide some initial pilot funding similar to what we've discussed about providing in the Housing Stability Evaluation Incubator. So yes, we have worked with housing authorities in the past and would be open to working with housing authorities in the future through this opportunity.
Great. So we've gotten a few questions about the kind of timeline and availability of funding in multiple years through JPAL. So this is the first year that we're running the Housing Stability Evaluation Incubator, although it is a model that JPAL North America has used in the past to kind of work with organizations and develop an evaluation idea. So though that is a model that we use at the organization, this is the first year that we're focusing on housing stability specifically and homelessness programs. And with that in mind, there's not like a formal decision made about whether the program will run again in future years, although that's definitely something we hope for. And I think kind of based on the outcomes of this year and the interest, depending on how many applications we get and how much interest we see there is in this funding opportunity, that will lead into the decision of if this opportunity will be available again in the future. On a separate note, our kind of RFP funding, so our funding available for a full evaluation once an organization has already come up with a design and been matched with a researcher, that funding is available on kind of a as-needed basis, and we do fund off-cycle projects that have some type of time constraint. So for whatever reason, if a project needs to be funded on a certain timeline, we're happy to look at those proposals for funding as needed. Great, and so another question we have is if an organization has multiple ideas for an evaluation, if they can submit more than one idea to the evaluation incubator, or how an organization would decide which idea to submit. So we welcome organizations to submit multiple ideas if you have multiple that you're toying between. There's no need to submit multiple, but if you are thinking about more than one evaluation idea, you're welcome to submit more than one. And we can help an organization in determining which programs are most suitable for a randomized evaluation in the case that you feel there might be multiple programs you're interested in evaluating, and we're happy to think through that process.
Yeah, and this is David. It might even be worth mentioning that the homelessness prevention study in King County actually came from such a process. So originally, in King County as a whole had at least two different ideas, one related to a law enforcement diversion program and one related to homelessness prevention. Yeah, so starting with multiple ideas helped us identify that this was one where there was particularly something valuable to learn and something feasible to do.
Great, yeah, thanks, David. Do you want to ask Rohit?
Great.
So whether there are evaluations that target specific groups of people or specific to communities, or rather than everyone in a community. So there are examples of this. So I think, for instance, you could take the King County evaluation that's been discussed, where it's explicitly targeted towards user families with young children. Similarly, there is an evaluation of rapid rehousing in Santa Clara that David is involved with that looks specifically at individuals with no dependents. So there are specific subgroups that are looked at. David or Kim, I don't know if y'all want to speak to that any further.
Sure, yeah, and the decision to do that, I think, kind of varies some on the context, right? In the context of homelessness prevention, right, families are particularly important of interest because we care about not just the welfare of the adults, but also the kids. And so that I think in King County was largely driven by that. That was just the program as it was designed. It was designed specifically for families and youth, and also for working with you. We've mentioned these 24 community organizations. Part of the actual design of the program we didn't talk about much is that the different organizations were particularly drawn into the program because a lot of them work with specific groups of people. They work with refugees or they various different groups around the community. So I think it from the researcher side, right, it's like that makes total sense because here are groups of people who are at particular risk of homelessness for various reasons. And there was good reason to design the program this way, so it's interesting to evaluate that particular thing because that was a program that made sense to design. In Santa Clara, the decision to evaluate a program specifically focused on singles without dependents was actually a little bit more practical there because we were that's a randomized controlled trial of rapid rehousing assistance. That's people who are already homeless receiving a few months of rent subsidies is the primary thing that they're getting. And we're doing a randomized controlled trial, which, as you might imagine, is a fairly difficult thing because there's a lot on the line for people. And so one thing there were a couple of features that were clear that we could structure a process that everybody was comfortable with. With singles, it might have been more challenging to do that with families in that context. And so for practical and ethical reasons, we gravitated toward a study that involved singles in that context. So I'd say sometimes it's sort of motivated by the policy question that we want to answer. Sometimes it's motivated by what's the right program design. Sometimes it's motivated by the practical issues of can we actually do this thing in a responsible way to decide on what's the right group of people to be participating in this thing. You're welcome.
Great. I think we're just waiting for any last questions to come in. Maybe we'll take one or two.
Great. So the last question we have, but yeah, please feel free to submit more questions if anything else comes to mind in the last few minutes before we wrap up. But we have the question, what are some examples of questions around homelessness programs or housing stability that can be tested through a randomized evaluation? So we are looking for any proposal that explores forward-looking mechanisms to prevent homelessness or interventions and services for people experiencing homelessness. All of that is potentially in scope, and we encourage you to submit a letter of interest if you are even unsure if your program might be in scope, but we can help you think through that after you submit your letter of interest. We do have kind of a research agenda that Rohit had mentioned is outlined in our evidence review, which is available on the JPAL website, povertyactionlab.org/homelessness, and that evidence review just outlines some of the open questions that we see in the field around how to best reduce housing instability and prevent homelessness. That said, just to reiterate, we really are interested in kind of any or all open academic questions that you might have as an organization about how to best prevent homelessness, how to best prevent evictions, how to reduce homelessness, or increase or promote housing stability.
Great. And we just got one last question. When we call for initial interest, should we already have an idea to run through with you and partners we will include in that proposal? So what we recommend is in the letter of interest, including the specific policy challenge that the letter of interest is intended to address, the description of a program or policy. So this is kind of where that idea would fall in, that description of the program or policy that you're interested in evaluating. And then also information about that program or policy to help the JPAL North America Review Board to evaluate whether randomization might be feasible in this case. So this will be information such as sample size, eligibility requirements, how enrollment takes place within the program. All of those kind of programmatic details are helpful in that initial letter of interest for getting a sense of if a randomized evaluation might be feasible. And we encourage you, if you have any questions specific to your program or your policy and whether it may or may not be a good fit for the letter of interest, we encourage you to reach out to our team here. As we mentioned, we are more than happy to chat with you over a phone consultation and help provide feedback on your proposal and strengthen your application.
Great, thank you all. And with that, I think we can call it a wrap on the webinar. Thank you all so much for joining. A special thanks to the folks in King County, Kim, Sarah, and Christina for their time, and David for your participation. And then, of course, to Jacob and Ariel for organizing this. Please reach out if you have any questions at all. Sign up if you'd like updates from JPAL and homelessness, and we will be circulating the slides and the recording of the webinar once this is concluded. So have a wonderful rest of your Monday, and we look forward to being in touch and receiving applications for you all. Thank you.